Hello, everyone. My name is Cheng Zhou. I'm from Department of Respiratory and Critical Care Medicine, Yulin Hospital, Tongji Medical College, Huazhong University of Science and Technology. It is my honor to discuss with you about the treatment protocol of COVID-19 infection, and I hope the content will help you. Firstly, I want to talk about the epidemiological characteristics about COVID-19. This is the basic principles about infectious disease. There are three items. The first is control the source of the infection. The second is cut off the route of transmission. And the third is to protect the susceptible population. So how to management the patients should based on these principles, because only in that way can we control the pandemic. The source of infection is the COVID-19 patients, and the route of transmission is the respiratory droplets or close contact, and all the population are generally susceptible. IPPT is made with reference to these two guidelines. One is by National Health Commission of China, version 7, updated on March the 3rd. The other is from WHO, updated on March the 13th. First is the treatment value. It's determined by the severity of the disease. For the suspected case, we treat them isolation in a single room. For the confirmed case, if the word is limited, we can treat them in the same room, and the designated hospitals should equipment with effective isolation, protection, and prevention conditions. And for the critical case, should in ICU department. Although in Europe, in America, the mild disease often be treated in outpatient and quarantine themselves at home. This is a guide from California Society, updated March the 23rd. There's no vaccine and no specific antiviral medicine to prevent or to treat COVID-19. So WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. And the antiviral drugs, what we will discuss later. And there are lack of controlled trials, and we must think about the potential for toxicity. So the use of these drugs is not recommended. For example, the chloroquine. But in America, doctors now use the azithromycin plus hydroxychloroquine. You can use it, but when we use these drugs, we must interpret it with extreme caution. The third I want to talk about is the NSAID. The NSAID, because the common symptom for the COVID-19 is fever, so people may use NSAID to relieve the temperature. But it was reported that the NSAID, especially ibuprofen, can increase the ACE2 expression, so maybe it's increase the infection for SARS-CoV-2. So WHO is not recommended to use NSAID at first, but later, on March 19th, WHO backed off on their recommendation to avoid NSAID. But as you know, NSAID is associated with increased heart attack and stroke. So in general, use these drugs the lowest effective dose and the shortest period of time. For the hospitalized patients, the general management is letting patients rest and have support therapy. Make sure the sufficient caloric intake and monitor water and electrolyte balance to maintain the internal environment stability, and monitor the vital signs and oxygen saturation because most of the patients is COVID-19 pneumonia. So the oxygen saturation is most important for our monitoring the condition of the patient. And according to the patient's conditions, monitor the blood routine result, the urine result, the CRP, the biochemical indicators, the liver function, renal function. And for some severe patients, the blood gas analysis, the chest image, and if necessary, the level of the cytokine and the lymphocyte subsets. For the severe COVID-19 pneumonia, timely oxygen therapy is so important. We provide the oxygen therapy in different ways, including nasal catheter, mask oxygenation, and the nasal high flow oxygenation therapy. It is depend on the level of oxygen flow that the patient needs to get the target SpO2 more than 94%. So we use pulse oximeters in isolation ward for everyone. Some doctors worry about the aerosol transmission by high-flow oxygen therapy. In our practice, if you follow the procedure, for example, adjust the parameter first and turn on the oxygen last, you can avoid it. For the high-flow oxygen therapy, compared with standard oxygen therapy, high-flow oxygen therapy reduces the need for incubation. Now we talk about the antiviral therapy. There are 5 antiviral drugs are introduced in Charlie's Guide. First of all, I want to emphasize that they can be tried to treat COVID-19, but we must evaluate the efficacy and the safety of these drugs in clinical application in your local hospital. The first is alpha interferon. It was used 5 million unit plus 2 microliter water and atomization twice a day. The other is the nimpulevar. It is a drug to treat HIV, 2 pills twice a day, less than 10 days. The other is the ribavirin. It's always used combined with interferon or combined with the leponumab, 500 microgram twice or 3 times, less than 10 days. And for chloroquine, it was based on the age and the weight of the patient to select the dose. If the patient age is 18 to 65 and the weight is more than 50 kilogram, you can use 500 microgram BID for a week. If the weight is less than 50 kilogram, for the first and second day, you can use 500 microgram BID. For the next 4 days, just use 500 microgram once. And for epidural, it's 200 microgram, 3 times a day, and less than 10 days. And for all of these antiviral drugs, we must be aware of the adverse reactions for all of them and the contraindicators and interactions of these drugs, especially for lympho level, reto level, especially for chloroquine. These drugs has very much interactions with other drugs. And 3 or more antiviral drugs at the same time is not recommended. This is a randomized, controlled, open-label trial involving hospitalized COVID-19 patients to evaluate the efficacy of lympho level, reto level by Professor Cao Bin in China. The primary endpoint was the time to clinical improvement, and the results showed that lympho level, reto level was not associated with a difference from standard care to clinical improvement, and also with the viral RNA node. So in conclusion, it is shown the low benefit was observed with lympho level, reto level treatment beyond the standard care. For antibiotic drug treatment, WHO does not recommend self-medication with many medicines, including antibiotics, as a prevention or cure for COVID-19. So rational use of antibiotic, especially avoid use of broad-spectrum antibiotics without evidence of co-infection with bacteria. For the severe and critical case, there's a treatment principle on the basis of symptomatic treatment. We must keep in mind do something to prevention of the complications and treatment of the underlying disease and prevention of secondary infections and organ function support, such as respiratory support, circulatory support, renal replacement therapy or immunotherapy, etc. We'll discuss later. And application of timely, effective, and safe supportive therapies is the cornerstone of therapy for patients, for the severe COVID-19 patients. For the oxygen therapy, we can use nasal cannulars or masks oxygenation when respiratory distress and hypoxemia of the patient cannot be improved after receiving standard oxygen therapy. The high-flow nasal cannular oxygen therapy or long-invasive ventilation can be considered. If the patient's condition do not improve or even get worse within a short time, that is always 1 to 2 hours after the high-flow oxygen or long-invasive ventilation, the tracheal intubation and invasive mechanical ventilation should be used in a timely manner. For the invasive mechanical ventilation, the non-projectile ventilation strategy should be considered. That is based on the ARDS study. That is to say, the no tidal volume and the no level of airway platform pressure is always should be less than 30 in order to reduce non-injury. Sometimes there exists human-machine asynchronization, so we use station and muscle relaxant in a timely manner. For invasive mechanical ventilation, if human resource is sufficient, floor position ventilation is recommended for more than 12 hours per day. If the outcome of the floor position ventilation is poor, the ECMO should be considered as soon as possible. Here is the ECMO indication include under the fraction of oxygen more than 90%, the oxygen index is still less than 80 for more than 3 to 4 hours. For circulatory support, I think it's your specialty. I don't need to talk. I just talk about the septic shock. There are some indicators for septic shock. When the patient's heart rate increased 20% of the base value, when the blood pressure decreased 20% of base value, and the patient has poor skin perfusion and decreased urine volume, we must think about whether there is septic shock of patient. And for ARDS patient, the conservative flood management strategy is recommended to avoid pulmonary edema. And for septic shock is always be seen in bacterial infection. But in the outbreak of COVID-19 in China, doctors have reported that only SARS-CoV-2 infection can cause septic shock. So we must monitor our patient very carefully. For the treatment of core infections, give empiric antimicrobials to treat all likely passengers as soon as possible within 1 hour of initial assessment for patients with sepsis. The 1 hour is very important if you want to decrease the mortality. And the empiric antibiotic treatment should be based on the clinical diagnosis, should be based on the local epidemiology data and the national treatment guidelines. And when there is ongoing circulation of seasonal flu, the anti-influenza drugs is recommended in the empiric therapy. We always test the virus RNA of SARS-CoV-2 and influenza at the same time. And after a period of time, based on the clinical judgment at the results from the lab, the empiric therapy should be de-escalated. For the convalescent plasma transplant, the indications are the patients with rapid disease progression, severe and critical illness, and the course of the illness should not exceed 3 weeks, and the RNA test was positive or other evidence of presence of viruses, maybe in the stool, and the infused dose is 200 to 1500 microliters 2 times. For the blood purification treatment, it can be used for the treatment of severe and critical case in the early and the middle stages of cytokine storm. So we recommend to detect the cytokine if there's a high level of IL-6, IL-10, especially for IL-6, we think about maybe the cytokine storm for this patient. For the blood purification treatment is including plasma exchange and blood plasma filtration. It can remove inflammatory factors and block cytokine storm. For the corticosteroid, every time when there is pulmonary infection, our doctors will debate this drug. Someone like it, someone hate it. The WHO recommend do not give systemic corticosteroid for treatment of viral pneumonia outside clinical trials. There were some suggestions in our country guide. If the patient with progressive deterioration of oxygenation, or if the patient has rapid progress in chest image, or you have the data about cytokine storm, the steroid can be considered. In a short period of time, it's always 3 to 5 days. And it is recommended to use methylprednisolone, and the dose is always 1 to 2 micrograms per kilogram per day. Every time when we use the steroid, we must balance the risk and the benefit. The benefit is it can suppress the inflammation, but the risk is the steroid can suppress the immune response, and maybe it can prolong the clearance of the virus. So every time when we use these drugs, we must keep in mind the balance, the risk and the benefit. Okay, so much for that is the content I want to share you with the guidelines with our experience in the treatment of COVID-19. For this emerging infection disease all over the world, there are so many aspects need to be studied. And early diagnosis and treatment is critical, and oxygen treatment is the most important in the management of the COVID-19 patient. For us, the clinical data should be collected to understand the lateral history of this disease, and RCT should be performed to evaluate the efficacy and the safety of the different therapies. That's all for today. Thank you so much.